Now you will see gout beyond this chapter. Gout is not just a primary condition, but it can also be a complication of cancer and cancer treatment. So you will see this again. Now, why is it serious? Well, this causes a lot of pain. And in some cases, it can also, if it is untreated, this can actually cause chronic kidney disease. Okay. So what is gout? There's two forms. There's a primary and a secondary gout. The both cases are high. So both cases are caused by hyperuricemia, which is high amount of what?
Uric acid.
In the blood. Okay. So what is uric acid? It's a byproduct of purine metabolism. Now, what is purine? Purine is found in most red meats, organ meats. I mean, red meats include organ meats, right?
Yeah.
Shellfish as well. Shellfish and crustaceans are high in uric acid. Some drugs also increase metabolism of uric acid, meaning it increases uric acid levels, such as certain diuretics and aspirin. Okay. So the problem here is as uric acid levels rise, they get stuck in the periphery. By periphery, we mean it could be your fingers, but in most cases, it's the toes. And the first digit that is affected is the big toe. Now, what's the big deal if the uric acid builds up in the big toe and obstructs circulation there? It'll cause a lot of pain and inflammation. Can you walk? No. So can this cause somebody to miss work, miss school? All right. With repeated attacks, because this is a chronic condition, they'll develop tophi. What are tophi? These are deposited, like I said, in the periphery. Could be in the great toe, usually, in the hands, and also in the ear. As I mentioned earlier, untreated and repeated attacks can lead to kidney damage. They can cause kidney stones and chronic kidney disease as a result.
Can it also be
Right?
mental illness?
Not typically, not the uric acid.
I know
No.
someone who has gout and don't get treatment. Now it's like the same thing.
It's more probably, does he have kidney disease already? Probably. It's a kidney disease, you know, they have a hepatorenal syndrome, which can cause encephalopathy. But like I said, there's primary and secondary gout. Primary hyperuricemia caused by severe dieting or starvation, or high intake of these, or heredity. Some people with gout are good with their diet, meaning they don't drink alcohol because alcohol is also high in purine. They don't, you know, eat a lot of red meat. They don't eat a lot of shellfish, but they still have gout. So that means it's hereditary, meaning no matter what they eat, their body just makes uric acid differently than most people. Yes.
So does antibiotics for
Yes, they have a high risk of having or forming uric acid. Well, they're gonna break down fat basically, and then that's where the uric acid could come from. In secondary, like I said, I mentioned cancer earlier, right? So here are some cancers, some anemias, because once you destroy cancer cells, what will always cells, regardless if it's cancerous or normal, leave behind? You know, when you destroy, they leave behind potassium and uric acid. Okay, so destroyed cells, dead cells always leave behind potassium because they will spill out their intercellular contents, which includes uric acid. Okay, so therefore this can happen either in when the patient has cancer, or especially if you treat the cancer, because chemo radiation will destroy the cancer cells, correct? And again, as they get destroyed, they still contain potassium and uric acid, causing symptoms of gout. This again is associated with diuretics, particularly thiazide diuretics, and also loop diuretics. Aspirin, as I mentioned, or alcohol. All right. Any clarification on these? So these are the drugs you think. So if someone has gout, are we going to give them thiazide diuretics or loop diuretics or aspirin containing products? All right. Or alcohol. Manifestations. Number one complaint is pain. Patient complains of pain in the toes. So these are the painful areas. So the tophi can form usually where again? In the great toe, in the hands, fingers, or?
Ear.
Okay, in the ear. Patient may complain and form kidney stones, and then they have other pain as well, this time in the flank area now, right? I won't test you on the stages of gout. Let's go to so all I'm testing are the manifestations. So these are your signs and symptoms here. Main characteristic again is pain. Okay, now let's go to treatment. So how do we help patients with gout? Depends on whether the symptoms are acute or chronic. Treatment will vary. For patients with acute attacks, so let's look at the acute attacks first, and then we'll go to maintenance. So let's say this is the first attack of the patient. They're in extreme pain. They cannot walk. They cannot stand. So they're in the hospital. What do we give them first? These are the treatments. Colchicine. This is only during acute attacks. Are we clear? Okay, you cannot give colchicine longer than 2 weeks. It is very nephrotoxic. It's very harmful to the kidneys. So therefore, if you give a nephrotoxic agent here, what should be accompanied when they take this? What should they be given instructions? Okay, fluids. Okay, so you should increase fluid intake, whether this is given oral or parenterally. Encourage increase PO intake while on this treatment. And how long is this given only? No more than 2 weeks, okay? The pain should improve after a few doses. 1 or 2 days of colchicine, pain should start subsiding and eventually go away. Are we clear? It's pretty strong. NSAIDs can also be given. Indomethacin only though. No other, well, they can benefit from Motrin and that kind of stuff, but for some reason, indomethacin is the most effective NSAID for gout, acute gout pain. Or they can be placed on steroids, obviously, to decrease pain and inflammation. Xanthine inhibitors. So let's say the patient has had the acute episode subside now. So they're better. Okay, and then they're diagnosed. The doctor will see, okay, what kind of gout do you have? Do you have the primary or the secondary gout? So if it's primary gout, that means what are the causes again for primary gout? Diet, what else? Heredity, alcohol, or yeah, some medications, right? So they will be placed on allopurinol. This is a maintenance medication they take every day in order to keep the uric acid production down. Okay. But what do we do during an acute attack? Will this still help? No, this is useless during a flare-up. So let's say the patient had a party. Okay, there's fiestas, and then there's festivals. Let's say who are Muslims here? What do you do after Ramadan? What do you do? A party, right? Yeah, a party after fasting. So do you tend to have a lot of meat involved there? Okay, a lot of red meat. So my mechanic is Muslim, and it's always like this. So when I go and then the shop is closed, I know what's happening. Okay, and unless it's just after right after Ramadan, I said, oh man, it's the son is at home, I'm sure. So when I call him, yeah, that's what's happening. Okay, he says, yeah, my friend, no, my toes are so swollen, my friend. No, it's because of the party. Okay. And this is what you teach. I mean, we're not saying do not eat shrimp or lobster. They're good, right? But just not too much. Okay. Can eat red meat, just not too much. Okay. And again, the problem with parties is they always combine everything, right? I mean, what do you see in a party? Red meat, shrimp, alcohol, right? All good for gout. Okay, very good. If they do not respond to the usual treatment, there's a IV treatment, which is an option, pegloticase. So this is the last resort. So if the patient do not respond to colchicine, indomethacin, the steroids, the diet restrictions, the patient will be given pegloticase. However, this can only be used in a hospital. We do not give it outpatient. In the first place, it's intravenous. Second reason is it contains a protein. The drug contains a protein that's usually identified by the body as foreign. So can it trigger an anaphylactic reaction? Potentially. So again, this drug is only given where? In a hospital setting. Because, and what should you have always on standby when you administer this IV? Okay, epinephrine and no, antihistamines. Okay, because remember, epinephrine, will it stop the allergic reaction? No, epinephrine will simply open the airway. Okay, so that plus the reaction has to be stopped by, because it's caused by histamine, right? So therefore, what do you give to stop histamine? Antihistamine. Okay, but what do you give first? Epinephrine first, and then diphenhydramine. All right, just in case. And this is a drug chart. So we have colchicine, probenecid, allopurinol. You can skip the probenecid. It's not really commonly administered. So we got colchicine and allopurinol. Okay. So those are the two drugs I can ask on gout. That's it for the semester.